Let's talk about a patient. We'll call him David. David came into the clinic absolutely desperate. For months, he had been dealing with relentless stiff neck and burning ache right to the base of his skull. He was doing everything right, getting weekly deep tissue massages, using a fancy ergonomic pillow, and constantly stretching his neck at his desk. The problem? The relief never lasted more than a few hours. When we evaluated David, we didn't just look at his neck. We looked at the foundation his neck sits on, the thoracic spine or the mid-back. When we looked at that, we immediately saw the real problem was obvious. His mid-back was completely locked up. In biomechanics, there's a famous rule. The part of your body that hurts is usually the victim, not the culprit. Your thoracic spine, the area from your shoulders down to your ribcage, is designed to be highly mobile, especially for rotation and bending. Your cervical spine, your neck, is delicate and relies on the mid-back to do its fair share of the work. But when you sit at a desk hunched over a phone or drive for hours, your thoracic spine rounds forward and becomes incredibly stiff. It essentially turns into a block of concrete. When your mid-back stops moving, your body still has to function. If you need to turn your head to check your blind spot or simply hold your head up to look at the monitor, the movement has to come from somewhere. Since the mid-back refuses to move, your neck has to hypercompensate. The delicate joints of the cervical spine are forced to bend and twist farther than they are designed to. David's neck wasn't the problem. It was just the overworked victim screaming for help. His locked up thoracic spine was the silent culprit. You can massage and stretch an overworked neck all day, but until you fix the foundation, the pain will always come back. At Major Family Chiropractic Center, we take a whole spine approach. For David, we focused heavily on adjusting and unlocking his rigid thoracic spine. Once his mid-back started moving correctly again, his neck didn't have to work overtime. Within a few weeks, the chronic burning and stiffness in his neck finally vanished for good.